According to the World Health Organization, the Delta variant is in 14 African countries. Less than 1% of Africa's population has been vaccinated. 22 African countries experienced over 20% rise in virus infections in the week ending 13th June, while fatalities rose by 15% in 36 countries in the same week. With African countries reporting weekly infections, contingency plans, including enhanced surveillance, rapid testing and revamping, is critical. Indeed, to ensure that the surge in COVID-19 infection is brought down. Joining us now, Dr. Prosper Hiag, President of Africa's Pharmaceutical Forum, APF. He joins us now from Cameroon for more on the situation on the continent. Thank you for joining us on the program. Doctor, first, share with us your experience during, especially the peak of the pandemic and in Cameroon there where you are. And this is also going by the numbers that Africa is recording now, and so far over 5 million cases.
Yes, more than 5 million cases all over the continent, which is, when you compare it to the figures of all of the world, it represents less than 3% of the COVID-19 infections. But what we have here in our continent is that the number of deaths is around 170,000 of cases of death, which means that we are still at the low level. But the main problem in some countries is how to collect the data, about the pandemic, the pandemic situation, and to provide them to the public. And that is one of the weaknesses that we are facing. The data, collecting evidence, it is a problem in our country.
Plus, there is the threat of, a third wave in Africa. Would you say that the continent is ready, and seeing as vaccination is quite slow?
Yes, there is a continued threat of the third wave, but Africa has continued to escape. As I told you, the worst of the pandemic, we don't know really the reason why we are doing less than the other part of the world.
So when we look at the pharmaceutical sector, what's your take on how the pandemic has affected that sector?
The pandemic has affected the pharmaceutical sector, mainly the supply chain. We in Africa, we import all our products. The production of our product locally is very low. So importing masks, importing medicines, importing everything from Asia, from Europe, was very difficult. And we had countries where there was no mask. Imagine, no mask in countries, no medicines, nothing, no oxygen in hospital. That is how we were affected. And I think that for the future, as we are seeing now, is to reduce the level of importation, to become more independent by importing less and producing more in our continent.
But Dr. Hiag, how do we do this? Do we need a flexible regulation system? Is that missing? How do governments in Africa support indigenous manufacturing?
The government, all the government are realized that there is a problem, there is a weakness. We African, we should not be reliable to the importations. Now the regulation is changing. You have at the level of the continent, the Organization of Regulation, which is also the African Continent of Regulation Organization, and you have the AMA. African Medicines Agency, which the treaty is being supported now by many countries to improve the regulation, to improve the local production in our continent. And that there was a point before coming to me about the CDC conference of April on vaccination, producing vaccines in our continent, which was a very, very interesting conference, but with the objective, the aim that we can produce vaccine in our continent. We can produce more drugs in our continent. Imagine that some countries are importing 99% of their consumption of drugs, which is not normal.
We are looking forward to that time. We appreciate your time on the program. Thank you so much, Dr. Prosper Hiag, President of the Africa Pharmaceutical Forum, APF. Thank you for joining us on the program.
Thank you. Thank you so much for inviting me here.